Hi, my name is Virginia Johnson, and I will be discussing akinetic mutism. Akinetic mutism in Chapter 12 of Phantoms in the Brain is said as damage to the anterior cingulate gyrus results in a bizarre condition called akinetic mutism. The patient simply lies in bed, unwilling to do or incapable of doing things, even though he appears to be fully aware of his surroundings. If there is such a thing as absence of free will, this is it. So, what is akinetic mutism? I have a video here that I'm just going to play in the background. The sound is not going to interfere with me talking, so I'll get that started. Just want to show you guys an example. So this is a patient with akinetic mutism, and as you can see, she's just laying there and her eyes are open. So people with akinetic mutism are unable to speak or move even though they appear alert. There are some cases where people's eyes can follow people around the room. It just depends on the patient. In some cases, patients actually have pain stimulus as well, so they can feel deep pain, but react to nothing else. And so, as you can see, the person is not able to follow the finger as they were trying. So yeah, that is what akinetic mutism can look like or manifest as in a patient. Known causes of akinetic mutism involve severe frontal lobe damage or a thalamic stroke, damage to the anterior cingulate cortex as stated in the book, or other diseases or damage to other parts of the brain. In most cases, it's a damaged part of the brain. In some cases, it could be a disorder or disease. I read online somewhere that a lady with schizophrenic would actually manifested akinetic mutism. So it just depends on the person. Known treatments are magnesium sulfate, cyst puncture, dopamine, and gas therapy. Those are just a few. There are some other treatments that had worked. It just depends on the person as well. So rehab could also work on somebody with akinetic mutism, or as well some some drugs as well. It just depends. Akinetic mutism revealing an ischemic stroke is an article I read, and it was a study done by Zidou, Jadane, Belcook, Bakali, and Bellamani in 2017. They observed a 44-year-old man who had an ischemic stroke along with akinetic mutism. The way they found this out was actually a friend of his went into his house and he was silent and motionless. And so he took him to the hospital, and that's where they revealed he had a stroke, and that's where they diagnosed him with akinetic mutism. Suggested treatments for him were, sorry for my pronunciations of these, but bromocriptine, levodopa, or paraglide. Other suggested treatments were rehabilitation or cognitive behavior therapy. The treatment that actually worked on him was rehabilitation and as well as anticoagulant therapy for a stroke. So those were the treatments that worked best for him. In another study done by Kenner et al. In 1999 was based off a 18-year-old woman who was admitted with akinetic mutism after having a posterior fossa surgery. To be exact, she had 6 days afterwards. The first 5 days she seemed fine. The way they actually helped her with her akinetic mutism was by using bromocriptine therapy, which is the drug, which concluded Kenner and his team that akinetic mutism could be linked to dopaminergic cell groups because the fact because of the fact that bromocriptine worked on her. And then the last study I read about it was done by Freeman in 1971. He looked at 3 different cases. He only had pictures for 2 of them. But so the first case was on a 68-year-old male. He was on his way to the bathroom and he fell. And once he fell, he couldn't get up and he couldn't move and he couldn't respond. And so his pupils were reactive to light, but he couldn't move and he couldn't respond. And it showed that he had bilateral softening from frontal lobe to the inferior occipital lobe with slight clouding and thickening of the meninges. So that was the case for him. In case 2, which is this picture here on the right-hand side, it was a 72-year-old male. He had fell as well, and once he fell, he became unresponsive, couldn't speak, appeared alert, but he wasn't. And occasionally he made spontaneous movements. Most of his damage was in the right middle cerebral artery. And in case 3, which is this photo here, it was a 62-year-old male and he was diabetic. He slipped into a diabetic coma. And once he opened from his coma is when they diagnosed him with akinetic mutism because his eyes were open, but he was unresponsive. They showed damage in both anterior cerebral arteries of his. So Freeman in 1971 concluded that bilateral lesions with damage to medial putamen, septum, medial frontal cortex, and cingulate cortex can result in akinetic mutism. All 3 of these studies show slightly different regions of the brain where akinetic mutism could form, but for the most part, they all had some type of brain damage. And in a few cases, there were treatments. The treatments depended on the person itself. Not each treatment worked for each person. In the case of Kenner and his team, the 18-year-old woman, once they figured out that bromocriptine helped her, they took her off and put her on a placebo and noticed that it got significantly worse. So they kept her on the bromocriptine therapy. So each treatment was different for each person because in the first study, the person sooner or later stopped the treatments completely. And that was my presentation. These are my references. Thank you for listening. And if you are interested in akinetic mutism, I would suggest looking into it because there are highly interesting articles found out there. I focused more on the ones with brain issues, but there were ones that correlated akinetic mutism to schizophrenic, bipolar disorder, all kinds of things. So look into it if you're interested. Thank you.